that. Okay, babies after bypass. What's the deal? Well, first of all, we want to emphasize that there's always a risk to mother and child during a pregnancy. And we should emphasize that as you get heavier, the risk to mother and baby goes up. So the risks of preeclampsia, eclampsia, that's where you have seizures or have to be hospitalized with high blood pressure, babies born small for gestational age or large babies, diabetes in mama, all those go up as you get heavier. In our experience and published reports, the risk of danger to the mama and the baby goes down as you lose weight after the gastric bypass. And we've had many of our patients who had children both before and after their MGB, and they have told us that their pregnancies after the MGB, when they were half the weight they used to be, were much safer and healthier, and they had healthier, smaller babies, didn't have diabetes during that. And so in general, we think it's much better to have your baby after your MGB than before when you're heavy. It's safer and better for you.
So does it affect after having an MGB? If you have another C-section, does that lead to...
Well, your C-section doctor is going to be a lot happier with you when he has to operate on you if you weigh 140 as opposed to 300. And it's going to be safer for you and better for you. The anesthesiologist will be happier. Baby will be happier. Everybody's going to be happier with that surgery the second time. Now, let me interrupt and say also, imagine that one of my patients is a stupid idiot. Okay? If you were to have the surgery and not take your vitamins and get low in a vitamin called folate, you can deliver a baby with the most tragic birth defect that we know that exists, a baby born without a brain. Okay? So low folate, which is a vitamin, which you could have an abnormal diet and not follow our advice, and then get a birth defect after the MGB if you didn't eat correctly and didn't take your vitamins and just were bad at following our advice.
Folate means folic acid? Or
Yep, folic acid is the other name for it. Folate, folic acid, right. If that's low in your bloodstream, your risk of delivering a baby with anencephaly, no brain, goes way up. And so it's possible somebody could have an MGB and really be dumb and not do the things we recommend. That's one of the reasons why we put our patients through the packet to help weed out people who are really blockheads.
what about, do you suggest after like the surgery, a lot of people use the term juicing, you know, like use your juice man. Maybe.
Oh, like when you take steroids?
No, not that kind of juicing. Always juicing, like you're drinking your fruits and vegetables. And
Yeah,
then
that's a good question.